Hey everyone, and welcome to another explainer. Today, we're diving into something that happens completely behind closed doors. But let me tell you, it affects the waking lives of millions of people. We're going to investigate, decode, and totally destigmatize the hidden realities of female snoring. We'll break down the latest research so we can understand exactly what's happening, why it matters so much, and most importantly, how we can actually fix it. Let's jump right in. Be honest with me for a second. When you picture someone snoring, who automatically pops into your head? A grandpa asleep in his favorite recliner? Maybe a cartoon bear? For decades, society has painted snoring as this inherently, exclusively male issue. But I am here to completely shatter that myth right now. Snoring is absolutely not just a guy thing. It's incredibly common in women. But you know what? It's almost never talked about with the same open, practical approach. And that silence is literally costing women their sleep and their health.
The truth is, so many women just kind of brush off their own snoring. Why? Because, well, it feels embarrassing. It gets treated like a punchline or this totally unfeminine secret that you have to hide from your partner, rather than what it actually is, a purely medical, anatomical occurrence. We really need to normalize this. If you or a woman you love snores, I want you to know you're seen, you're understood, and you're dealing with a completely normal human physical response, not some sort of character flaw.
Okay, let's get into the mechanics of this in Section 1, Everyday Anatomy and Triggers.
So, at its very core, snoring is really just about vibration. It happens when the air trying to get through your nose or throat hits a partial roadblock. As you force air through that narrow little space, the surrounding soft tissues literally just vibrate, kind of like a flag waving in the wind. And honestly, that's it. It's just simple physics. Once you understand that, it takes the embarrassment completely out of the equation. It's a plumbing issue, guys, not a personal failing.
Now, when we look at the big picture, there are about 8 main reasons women snore, and we can elegantly sort them into 2 distinct buckets. On one side, we have everyday environmental or lifestyle triggers, things like back sleeping, nasal congestion, alcohol, or carrying a bit of extra weight around the neck. On the other side, we have biological factors. These are deep physiological shifts that are often super specific to women, like menopause, pregnancy, and thyroid or PCOS issues. It's absolutely crucial we separate these out so we can pinpoint exactly what kind of situation we're dealing with. Let's rapidly fire through those everyday triggers first. Carrying extra weight around the neck actually physically narrows the airway. Nasal congestion from seasonal allergies, that forces you to breathe through your mouth. Sleeping on your back allows gravity to just pull your tongue backward. And having alcohol or sedatives before bed relaxes your throat muscles maybe a little too much. But hey, the great news here is that these often have super simple fixes. Try sleeping on your side, maybe grab a wedge pillow, or just skip that nightcap right before bed.
Moving right along, let's look at Section 2, Hormones and Life Stages.
Now, this is where the story gets really fascinating. A woman's sleep architecture is massively influenced by her hormonal journey over time. During the second and third trimesters of pregnancy, snoring can suddenly just appear out of nowhere. Moving into the reproductive years, conditions like PCOS or thyroid issues can become major culprits. And then finally, later in life, perimenopause and menopause bring these massive hormonal shifts. At every single stage of this timeline, a woman's changing biology directly impacts how she breathes at night. Let's actually compare what's going on under the hood here. During pregnancy, the issue is kind of additive. You've got increased fluid retention, soaring nasal congestion, and sudden weight gain that physically crowds the airway. But during menopause, the issue is subtractive. Your levels of estrogen and progesterone rapidly decline. And here's the so what of that. Those hormones actually help maintain your muscle tone. So when they drop, your airway literally loses its stability and just becomes floppier. Just consider this for a second. A woman in her 50s who has literally never snored a day in her life might suddenly start waking up her partner after menopause. Imagine how incredibly frustrating that must be. You go 5 whole decades sleeping silently and then bam. If this sounds like you, please know this is a fully documented medical shift. Your airway tone changed, you aren't imagining things, and it is so, so common. But we also absolutely have to talk about underlying metabolic conditions. Backed by data from the Mayo Clinic, conditions like polycystic ovary syndrome, or PCOS, and thyroid issues are major suspects in our snoring investigation. These conditions cause complex hormonal imbalances that don't just lead to light, fluttery snoring, they actively raise the risk of obstructive sleep apnea. This is the turning point where snoring goes from being an annoying nuisance to a genuine health concern. Which brings us right into Section 3, the sleep apnea connection. Okay,
How many times have you heard someone say this? Oh, I only snore a little. I want to directly challenge that statement right here, right now. It is such an incredibly common but honestly dangerous trap. A lot of women use this phrase to kind of brush off their symptoms. But the research is crystal clear. You can snore very lightly and still suffer from severely disrupted breathing and terrible sleep quality. Volume does not always equal severity.
So what actually is obstructive sleep apnea, or OSA? Well, it's a very serious underlying breathing problem. This isn't just about the vibration of tissue anymore. It's about the complete collapse of your airway. Snoring is really just the siren going off to warn you, but the actual danger lies in the gasping, the choking, and those terrifying pauses in breathing that happen alongside it. We really need to draw a hard line between these two worlds. Benign snoring, that's caused by things like seasonal congestion or maybe just rolling onto your back in your sleep. It's annoying, for sure, but it's basically harmless. But then we have sleep apnea red flags. If your snoring comes with gasping or choking sounds, if you're waking up with pounding morning headaches, or if you're dealing with crushing daytime sleepiness, that is your body waving a massive red flag. That is an oxygen deprivation issue. I really want to empower you with an actionable checklist here. When do you actually need to escalate this to a professional? Well, you see a doctor if the snoring is totally new, or if it's suddenly getting way louder. You see a doctor for those chronic morning headaches, or if your partner actually witnesses you pausing your breathing. You also need to pay close attention if you have high blood pressure or experience severe pregnancy snoring, especially if you're dealing with swelling. Do not ignore these signs, guys. All right, let's wrap this up with Section 4, Next Steps for Better Sleep. Look, I totally get it. A lot of people put off getting checked out because the idea of sleeping in some sterile clinic lab covered in wires is just terrifying. But today, the tech has evolved. You can actually start with an at-home sleep test through services like CPAP RX to figure out exactly what's causing the problem. Literally no clinic visit needed. It's entirely private, it's super easy, and it takes all the embarrassment out of the testing process. You can get real medical answers from the comfort of your own bed. The journey from waking up exhausted every day to getting treated for sleep apnea is basically just 3 simple steps now. 1, you order the at-home test. 2, you get a precise doctor-reviewed diagnosis. And 3, if you happen to need it, you explore CPAP solutions, machines, and all the modern comfort accessories, like those new low-profile nasal masks that make therapy so much easier today than it used to be. It's a straight, simple path to getting your energy and your life back. I want to leave you with a question to chew on. Are you ignoring your body's nightly cry for help just to save face? Snoring is not a joke, and it certainly isn't some secret you need to hide out of embarrassment. It is a physiological signal. Listen to your body, look at the evidence we explored today, and take that next step toward the restful, healing sleep you absolutely deserve. Thanks so much for joining me for this explainer, and I'll catch you on the next one.